Good afternoon and welcome to United TV. My name is Kemal Erkan. Today's episode, I'm excited to have you join us for an important discussion for bariatric surgery and the impacts of smoking and alcohol use. As many of you know, bariatric surgery is a significant step towards achieving the long-term weight loss goal and improving overall health. However, the journey doesn't just stop with the surgery itself. There are crucial lifestyle changes that needed to be made to ensure the best outcome for the surgery. Today, we have our regular expert, Dr. Isaias Irgau in bariatric surgery, who's with us. Dr. Irgau is going to shed the light on how smoking and alcohol use can impact both patients. It can impact patients both for before and after surgery. We are going to explore the risk associated with smoking and alcohol with these habits and why it's important for you to follow your surgeon's order. So, Dr. Irgau, thank you for joining me today. How are you doing?
I'm doing great, Kamal. I was just thinking when you said expert, I kind of reminded myself now that it's almost 25 years since I've started interest in bariatric surgery. And of course, so it's over 20 years now since we did our first laparoscopic gastric bypass. Dr. Wynn and I, the first really surgeons to perform laparoscopic gastric bypass here in the state of Delaware. A lot has happened since then.
Well, it did, right? So 25 years is a lot of time. And in our program, we had more than 10,000 cases under our belt. And, this is one of those jobs, I would say, that comes with expertise. Not all jobs does have an impact, but there's certain things that requires a number of times that you repeat them same way with new techniques, improving what you do. But in order to improve, you have to be able to do it in the way that everyone is doing before. So it's amazing. It's amazing how we have to do, the surgeons, you guys have to do day-to-day maybe learning still after all that. But then I'm thinking, like, how is someone who's just coming out of residency dealing with something that you are able to deal with? Just like that 25 years is giving you an excellent advantage. And also, we are still teaching those residents and others and new surgeons, right?
That's right. That's why it's called the practice of medicine, Kamal, because you're all the time you're learning, you're becoming better. Your patients are teaching you, all the time. And of course, there are developments in medicine and in surgery, and we have to obviously learn continuously to stay up to date. And we do, and we're very proud to say that the CHRIAS, the Christiana Institute of Advanced Surgery, is always at the sharp end of the developments in terms of providing minimally invasive procedures, but also added knowledge and protocols that continuously improve the outcomes and the care of our patients. And today's topic is really pertinent to that because you have to really have had enough experience to understand in depth the importance, of these topics that we're going to tackle today.
So, Dr. Irgau, the way that I would like to kind of starting from smoking and pre and post impacts of smoking and why this is a risk factor for those who are going through well, it's a risk factor for everyone. But for those who are going through the surgery, it's a bigger risk factor. If you can talk about the complications with pre and post surgery, if they are smoking, then we'll just go to the next questions.
Right. It should be a fairly straightforward topic, right? Smoking is bad, period, right, Kamal? But it is really, really bad in the setting of bariatric surgery. And that's why we emphasize greatly about the need to quit smoking before bariatric surgery. And the reason we want people to quit smoking even before bariatric surgery is not just necessarily because it is important for them to stay quit after surgery, and we'll talk about the after surgery issues, but really for them to go through the surgery safely. It's important that they prepare themselves in the best possible way. And if they are smokers, by far one of the best things they can do to reduce the risk of potential complications of bariatric surgery, Kamal, is to quit smoking. right? And we tell them to quit smoking at least 4 weeks before surgery, if not before, right? And why is that? Well, because there are very well-known complications that go along with people who are continuously smoking and they undergo anesthesia, whether this is pneumonia, whether this is cardiovascular problems or blood clot formation. These are potentially serious and life-threatening complications that can be completely avoided if a person quits smoking. So there is really no issue here. In fact, as you know, in our program, we would not proceed with surgery unless the person has quit smoking completely, because really the risks that the person is undertaking by continuously smoking is just not worth for the patient. And we feel very strongly about that. And of course, bariatric surgery is a necessary surgery, but it's not emergency surgery, which means that we do have time to prepare. And if the patient has really struggled and they're not ready yet, well, we wait. And it's not that we just send them out and say, oh, you have to stop smoking. We understand that stopping smoking is one of the most difficult things anybody can do. And we tell patients that, openly. And of course, most patients know that as well, because for the vast majority of patients, the understanding that smoking is bad for them is inherently known by now. And of course, they will have tried many times but failed. But it is interesting that by the time they come to realize that bariatric surgery is important for their life, it's almost like they come to an epiphany, Kamal, saying, like, this has got to be the reason for me to stop. And the vast majority of our patients actually end up stopping smoking. And it's wonderful to see somebody not only getting healthy by losing weight, but having stopped smoking as well. It's really a wonderful, wonderful outcome. And patients who have stopped smoking after years of smoking and patients who lose weight after bariatric surgery are just a delight to see post-operatively, because they become healthy in every way, obviously, because of what they've accomplished. So stopping smoking before surgery is very important, and it's also mandatory in our practice. And as I said, we don't just say to patients, go stop smoking. We do provide help as well. This help comes in terms of counseling. There is a wonderful smoking cessation, pathway that we have through our United Medical Program. And obviously, we ask for their primary care doctors to help us as well, either by providing medications or counseling, so that they can do it. And the other important thing is that there is time for them, right? Because when we see them for consultation for bariatric surgery, once we counsel them about the importance of stopping smoking, the whole process of preparation for bariatric surgery takes several weeks, if not months. And so they will have time to really adjust and stop as well. So preventing complications related to the actual surgery, to the anesthesia, is important. But how about staying quit afterwards? Why is it important for people, for instance, not to resume smoking afterwards? Well, there are important reasons, because smoking happens to be very, very bad in terms of complications it creates after bariatric surgery, particularly people who've had gastric bypass, for instance, Kamal. They can develop ulcers at the connection between the stomach and the intestine. It's called the anastomosis. It's the new connection that we make to construct the gastric bypass anatomy. And that connection is very vulnerable to formation of an ulcer. An ulcer is almost like a wound where the normal lining of the GI tract is lost, and there is clearly an open wound there. And that open wound cannot heal if the person is continuing to smoke. And if it doesn't heal, what happens? They have continuous pain, and this pain is a nagging pain that is very difficult to get out from. Most importantly, the ulcer can burst, Kamal. If the ulcer bursts, they could have a life-threatening infection called peritonitis. Or even worse, a blood vessel within the ulcer can burst, leading to massive internal bleeding, right? And that can be life-threatening as well. So these are real and present dangers that are caused by ongoing smoking after bariatric surgery. So it is very important for people to stop smoking. Of course, there are the other problems, as you know, the heart disease, lung disease, cancer, that are going to come with smoking. So it makes no sense for a person to cut the risk of dying early by doing bariatric surgery and then cancel that totally by resuming smoking, essentially.
So if you can, sometimes when I have struggles with different terms in medicine, you kind of break those down, and you're one of those people who have a lot of patience. Like you don't rush and you explain and like after I listen to you, I really 97% of the time I have 100% understanding. So how is smoking affecting my stomach? Like, because I thought it was going to affect the lungs, right? Patients are, saying that. So what's that connection? If you can just break that down.
So it's simple, Kamal. When people inhale the smoke does not just go into their lungs, it's swallowed as well. And the smoke itself is full of noxious chemicals that just are irritant to the delicate surface of our gastrointestinal tract, right? It is actually a very, very delicate surface, and that surface can be irritated by these chemicals very easily. Now, why is it so much more pertinent after bariatric surgery? You could say, why is that not the case, for instance, for a normal stomach, right? Well, because particularly in gastric bypass, when we connect the intestine to the stomach surgically, that is an unnatural connection. That's a surgeon-created connection, right?
Right.
It's a natural connection. And by itself, that connection is vulnerable to creating those wounds that don't heal. They're called ulcers. So we call this anastomosis, this connection, ulcerogenic, which means it's prone to create ulcers. Now, granted, these ulcers can happen even in somebody who's not smoking. For instance, taking medications like aspirin, called non-steroidal anti-inflammatory drugs, can cause that. But the key difference is that if the person is not a smoker, Kamal, we can treat that ulcer. We can provide anti-acid medications that will lead to a complete healing of that ulcer. In other words, you do endoscopy, Kamal, you look at the surface, you see that little crater of the ulcer, the wound, the cavity of the ulcer, right? You give the person medications like anti-acid medications, let's say for 2 months. You go back and do endoscopy, and that surface will be beautifully healed. It will not be there anymore. But if the person is a smoker, you go back and look by endoscopy. Now the ulcer has become chronic. It's like a very old scarred wound that won't heal. And those ulcers are at great risk for bursting or creating massive bleeding. And that is precisely because the person has continued to smoke. So ongoing inhalation of those noxious chemicals that are part of the smoke that we inhale if we smoke, those are what are causing the irritation that will lead to poor healing of that wound, of course.
So that is pretty straightforward, I guess. So I think
Absolutely.
people should
Absolutely.
really understand this is not just the smoking here and here. It goes into the stomach. It's impacting the stomach, and we make modifications there. And recovery is the most important thing, and especially recovery. So. And what you don't, let me actually just share something. So
Yeah.
I'm going through a small problem these days, and to see the progress, Dr. Ergau, I won't go into details, but it takes several days, and in some cases, several weeks, even without the operation. So I'm going through that right now, and it's on the right direction, it's healing, but it's not gone.
Yeah.
So what we know is, and I'm not talking about the surgery specifically, but just the problem that we have in our body. So the process is a slow process, and we don't want to not only slow down that process, we don't want to complicate that process.
Right. Right.
This is that simple. So if I knew that, let's say if I was a smoker, and if I knew that my problem today, which is not a major problem, could be disappeared in 3 days versus if I'm smoking, it's going to be several weeks. I would stop smoking right away.
Yes, of
So this
course.
is, you that's why I'm saying that it's pretty straightforward from that point. So And then, as you mentioned earlier, we have our care managers, care coordinators who are nurses who handle the smoking cessation, and we are here to give that extra support for them. But the thing is, you won't go through the surgery unless you quit smoking. So this is why patient needs to really understand it's an important factor. Because, I mean, just think about how much work we do to make the recovery better, less painful, less nausea, and less all those things. And boom, you are sabotaging the process with a couple of stupid cigarettes. So that's just like you don't want to do that to yourself. So uh, should we go to the alcohol and
So another important topic. Yeah.
so I'm drinking water. It looks a little bit dirty, but there's nothing in it. It's just, it's from here to here. So then it looks better. Mom actually says, don't drink it from this when you are live. Okay, so here we have. But
Yeah.
drinking is another problem. Of course, not drinking water, but drinking alcohol. This is another risk factors and complication reasons. So what's the background on drinking and bariatric surgery?
So again, it has to do with the fact that bariatric surgery changes the anatomy of the digestive tract, and that the consequence of that is that the processing of alcohol is different by our body, and that has real consequences, obviously. So one of simple examples, for instance, and throughout the last 20 years, we've learned a lot about the effect of alcohol and its impact after bariatric surgery. So there is something called peak blood alcohol level. In other words, if a person drinks alcohol and you measure the alcohol level in their blood, there is a peak that is going to be reached at a certain point after they drink alcohol, right? So for a normal person, normal meaning a person who has not had any bariatric surgery, they have a normal anatomy of their digestive tract, let's say the peak blood alcohol level may be about 25 minutes, okay? For a person who's had a sleeve gastrectomy, that peak blood alcohol level time is reduced to 9 minutes. Okay.
25 minutes.
For a person who's got a normal anatomy, it's 25 minutes. For a person who's had a sleeve gastrectomy, that is reduced to 9 minutes. For a person who has gastric bypass, it can be as little as 5 minutes, which means that the effect of alcohol is going to hit that person much more quickly after bariatric surgery. And the reason is straightforward, again, because the changes that we entail either with the sleeve and more importantly with the gastric bypass will lead to the passage of the contents of the stomach into the intestine where things are absorbed very quickly, much more rapidly than in a person whose anatomy has not been altered. That is the key essentially, right? So a glass of wine is maybe much more intoxicating, much more quickly to a person who has had bariatric surgery, right? So if a person before bariatric surgery, they drink a glass of wine and they say, you know what, I am fine. I don't feel bad at all. In fact, I may even be able to drive. If I am stopped, they're not going to be able to detect anything because my alcohol level is going to be low. Well, guess what? After bariatric surgery, that changes. It changes drastically. So a person who consumes one glass of wine now may reach a blood alcohol level, which is the level of intoxication much more quickly. So they may not be eligible to drive based on that one glass just because the alcohol becomes intoxicating much more quickly. And there is another effect. Not only it reaches their system much more quickly and the peak of alcohol is reached much more quickly, but the alcohol takes more time to leave their system compared to somebody who has not had bariatric surgery. Right? So those are real effects, right? And then the other very, very important concern that we have, Kamal, is that for a number of reasons, bariatric patients seem to be more at risk for becoming alcohol dependent if they indulge in alcohol. And there are a number of theories for that. And one of them is that if a person has struggled, for instance, with weight most of their life, and part of the adaptation has been, for instance, to deal with stress by eating, right? Now that they've had bariatric surgery, they are not able to deal with the stress by eating because we made their stomach so small that they cannot, right? So getting to a different maladaptation to try to deal with their stress is almost much more likely, and alcohol is one of them. So not only now the effects of the alcohol immediately are much more prominent, but long term, the alcohol issue could become a real problem for them. And that obviously is disastrous because the potential for liver failure, for instance, are much, much higher. Much lower levels of alcohol in an ongoing basis can lead to liver failure in a person who's had bariatric surgery compared to a person who has not. So what is the bottom line here? Come on, the bottom line is that we're not saying, you can never drink alcohol. We're saying there are warning signs here when you drink alcohol that should be much more prominent when you've had bariatric surgery, compared to a person who has not had bariatric surgery, right? These are important points. Now, some bariatric surgeons say these risks are too many and too high. Let's have a policy where we say everybody who's had bariatric surgery should abstain from alcohol completely. And that's the viewpoint. We may not be able to realistically bring that about, Kamal, because the vast majority of post-bariatric patients are actually responsible drinkers. They get the message provided we are teaching it. And so we should not be penalizing them, because of this. But we have to really be able to recognize the patients on whom this could be a problem. So, for instance, if a patient tells me that they've struggled with alcohol at some point in their life,
Right.
Kamal, that's a red flag. I say, okay, you're off alcohol now, good for you, right? You've been dry for so many years, you've abstained, you've done extremely well, right? Now that your life is going to be transformed with weight loss surgery, where your lifestyle is going to change, right? Is the temptation going to come again? And if the temptation comes back, are you going to fall again for that? Well, the possibility is there. So for patients who've had any type of alcohol problem in the past, I absolutely tell them, don't even touch a drop afterwards. That's the best and safest policy.
Well, the other thing is, I guess, when they are going through this major change, major procedure, why do we do it? For weight loss, right? So, well, we have to kind of avoid these easy, low-hanging fruits to prevent the weight regain. And well, the alcohol has a lot of calories. So even if someone is able to handle it, for them to actually, again, I'm going to use the term sabotaging. So sabotaging the process is the alcohol consumption. So that's something that, the other thing, Dr. Gao, the process that we take our patients from the beginning to the end, to the surgery, but even after the surgery, we don't actually, wash our hands. We keep in touch with them. So I guess there's a really strong support coming from the program. So that actually helps them to really better understand. I mean, this is our maybe eighth or the ninth time that we talk about this specific topic because this is so many times it's repeated. And like we don't see much pushback. Like I'm on day-to-day, daily case conferences. I mean, when the last time the alcohol issue came up was, I mean, I don't remember. I mean, smoking comes up from time to time, but it's not a lot.
Right.
So because this is like clearly understood, and I think the support is there. And again, we want this to be long term, right? We want the results to be quick, permanent, and so we can, just claim the new life that we want for our patients. So these two things are just going to sabotage the process for recovery, for the longevity, and the easiest is, getting rid of those habits way before the surgery. So then things are less complicated for us. Now, one of the other things that you emphasize, although all of them are bad, but based on the surgery types, things can get from worse to critical. So then, like especially those patients with bypass, they need to be like very, 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 very careful. So if everyone else needs to be like three very careful, they need to be the most careful because this is impacting them at the most. So as you mentioned, next time I'll play this video. It's showing the GI tract and how things are moving.
Yeah,
With bypass, we make this modification. That's why it's called bypass. So there's no stomach anymore. So the things are going into the
yeah,
intestines, and that that's the second brain
yeah,
there. And when things are given prematurely, a lot of things can happen. So,
absolutely.
and I think when people watch that video, they will understand what the process is a little bit better. Not like they don't know, but I think when we see it, it's it's a little bit easier to kind of connect the dots. Um, uh, Again, so I think it's a pretty straightforward topic, and you, as always, you explain these very well, uh, and hoping that no one would sabotage their process. So, anything else you would like to add before we close?
Yeah, I mean, among the other physical effects of the alcohol, obviously, there are also damaging effects of the alcohol itself on the surface of the digestive tract, pretty much in a similar way to smoking, and that is, for instance, worsening heartburn. If people have heartburn after the sleep, worsening the potential for formation of ulcers both in the sleep and also in the gastric bypass. Of course, we mentioned liver failure. The fact that with drinking there is really impairment of judgment, which means people are not going to be careful about what they eat and how they eat if they drink alcohol. You mentioned the fact that alcohol is really empty calories, no nutrients, no protein in it,
Right.
and just leading to increased appetite and weight regain as well. There is something called dumping syndrome that can happen, particularly after the gastric bypass with alcohol as well. So different effects. And then the other thing that we should mention is dehydration as well. People can become dehydrated because of the effect of alcohol. And that's obviously a serious problem after bariatric surgery because hydration is not something that you can do as easily after bariatric surgery as you do before bariatric surgery, just because the stomach is so much smaller. So different potential, problems and difficulties that can occur if one is not fully cognizant of the dangers that we have with excessive drinking and obviously any type of smoking after bariatric surgery.
Well, Dr. Isaias Irgau was with us, and we learned a lot today again with the smoking and alcohol utilization during the bariatric surgery process, risk and complications. Dr. Irgau, thank you for joining us, and
Thank
we'll
you,
be
Kamal.
speak with another topic. Thanks again.
Bye-bye.